Hello again and welcome. This is Dr. Jerry Cuomo. I'm here in my Boca Raton office. We're doing sealants this week. So here we go. Patient came in, pediatric dentist, and she now needs her second molar sealed up. We're going to go ahead with this lower right second molar. She's already had the lower right first molar sealed. Sealants do definitely what they do. They're preventative dentistry. It's preventative dentistry. It's getting into these extra special grooves, and we're just going to put a small little thin barrier in here. We're going to do it with Flowable Composite. After we do the little fissurotomy, all the pits and fissures, they're natural pits and fissures. We want to maintain them, but we want to also just go in and clean them out. So there's a little bit of bioburden in there. We're going to direct vision. So I'm just going to use a real small mirror to kind of keep her cheek out of the way. We did the upper, now we're going to do the lower. Basically, very light touch here, grooving these, get them all cleaned up. I like this technique because it's very specific for the grooves. That's where the issues are, not the flat surfaces. It's more these convoluted areas of concern. She doesn't have any buccal pits, so the main depth is right here in the central pit. Easy to see. We'll get a little closer now, and I'm going to use something called Concepsis now. Concepsis is next, made by a company called Ultradent. We're going to come in with an inspiral brush tip and just literally floating all that debris out of there. Now I'm going to go ahead and rinse that off. And then we're going to go right into etching. All right, so we're going to use a product from Bisco called Total Etch, 37% phosphoric acid. We're going there. Going to etch for about 10 to 15 seconds. Dental assistant's going to turn off the suction now. She's going to keep retracting. There we go. Nice aqua color. Now we'll scrub that up. Really work it in there. And you'll see all the little enamel tags when we're done. There you go. There we go. Rinsing. And we're isolating with just gauze today here. No rubber dam. Now it's wet, but we're going to change the gauze first. Cotton plier. Got it. Okay, we're going to back this up, show you how we change out the gauze. All right, get the other one ready. Keep the tongue out of the way. Put it right in there, just like that. Now take the air syringe and suction at the same time. Okay, now you know that tooth is ready for us. Now we're going to lower the light and use the adhesive. I like the 3M product here. This 3M adhesive seems to work pretty well for us. I'll put some in there and then thin it down with the air syringe. So this syringe that I'm using, I'll show you this syringe. It's clearly marked with a blue marker. Let me just show you that. See the blue stripe on that? So that tells us all that there's no water coming to this syringe. It's completely filtered air. There's no water whatsoever. You can push both buttons, no water comes through there. Here comes the adhesive. A few extra steps. I know sealant suction again in there. Yeah. There we go. Gonna keep her tongue from getting in there. Now we're just thinning it down. We're gonna light cure that. Okay. Cover cure. There we go. I'm going to cure for about 10 to 15 seconds. And go right to the flowable. The type of flowable I'm going to use is called Wave. And this one is from SDI. Wave from SDI. Okay. Get right back in there. So when we lower the light on the microscope, it goes down to a very, very low level. Very, very low level. Like less than a watt of power. All right, we're working so hard here. Tomorrow is Thanksgiving, so everybody's thinking about their next day tomorrow. All the family coming over. And students are taking time off. They're probably already flying out or visiting family. They closed the gym today, I know that. I went over there and it was closed at the university. That's okay, I got to the office a little early. I'm going to remove a little excess here, just a tiny bit. Tiny bit. Just get rid of it. And I'm doing that with the perio probe, just getting it out of there. It's beautiful. So why did I run the Explorer in there? Because I didn't want any air to get trapped in there. You can actually get some of the air out of there. And also it scoops out some of this material. It's going to shrink a little bit. We all know that, right? C factors all over this world of composite. Configuration factor, that's the amount of shrinkage a composite's going to do. So now she's got the upper right, second molar, lower right, second molar, all sealed. We're going to do the left side and enjoy the day and the anticipation of a wonderful day tomorrow. And then all the shopping starts. All right, let's take a close look at that with the light fully up. And I'll run the Explorer in there so you can see how this product looks. And here it is, all nice. Look at how shiny that is. Look really close at it. Look at the beauty, you know, the beauty of that. Nice and smooth. Hopefully give her many, many years of good use here. Keep these teeth sealed up and safe for her life. This is Dr. Jerry Como. Thank you for watching, and again, enjoy your holidays out there. Take care.